Hi, I'm Ginta and I'm a 33-year-old oncology nurse living in Chicago. My first symptom of Wilson disease started appearing in my early teens, and my neurological symptoms progressed while I was under significant stress in nursing school. Looking back now, the several doctors I saw at the time were attributing all my neurological symptoms to stress and anxiety. It wasn't until an optometrist happened to accidentally notice Kaiser flesh rings in my eyes that I finally received the correct diagnosis. My treatment journey has been very long and very complex. When I was first diagnosed, I was initially prescribed treantine and zinc. One of my neurological symptoms I was experiencing at that time was dysphagia, or difficulty swallowing, and I couldn't get the capsules down. My mom and I ended up cutting the capsules open and dissolving them in water, even though this wasn't recommended, but we had no other choice. This ultimately led to unrelenting nausea and vomiting, which led to my hospitalization. But once I was stabilized, I slowly began taking the medication and slowly started showing neurological improvement. After a few months on treatment, I was able to begin working part-time from home as a nurse. I didn't yet have the strength for anything more physically demanding. About a year into my treatment, my improvement plateaued. Around that time, my neurologist told me about a study drug called tetrathiamabdilate, and shortly after, I enrolled in the clinical study. That was one of the best decisions I've yet to make in my life. I remained on the study drug for more than 5 years, and I believe it completely reversed all my neurological symptoms, and I was able to return to working full-time as a nurse in the hospital, something I wasn't sure I would ever be able to do again. During that time, I felt healthy, capable, and most importantly, I felt normal. My body tolerated the medication extremely well. Sadly, the trial was suddenly terminated, and the medication I had relied on for over 5 years was no longer available to me. It was truly devastating and left me scrambling to find a new treatment. Around that time, Kuvryar had just been approved by the FDA, so we tried that next. However, the transition period was extremely difficult for my body. I cycled between treantine, Kuvryar, and zinc for over a year, suffering from unrelenting nausea, vomiting, and significant weight loss, which almost led to another hospitalization. Currently, I manage my Wilson disease with a combination of medications. For copper chelation, I take Kuvryar. For migraine prevention, I use a monthly subcutaneous injection called Ajovy. And for abortive medication, I use Ubrelvy. I also take propranolol, which helps with anxiety, hand tremors, and also helps with migraines. And I use Zofran as needed for nausea, and I also receive Botox injections in my back every 3 months by my neurologist for my dystonia. The main goal of my treatment is to keep my copper levels stable. While my current medications do achieve that, the side effects still have a major impact on my daily life. Because Wilson disease medications must be taken on an empty stomach, nausea is something I still have to be mindful of. It's more manageable now, but it's always there in the background and adds another layer to getting through a full workday as an oncology nurse. If I could describe an ideal treatment, it would be something simple to take once a day, well tolerated, and effective at keeping copper levels stable. It wouldn't require refrigeration, which can be especially challenging for people who travel or work irregular hours. Managing multiple medications several times a day, often on an empty stomach, can be overwhelming and makes long-term adherence much harder for Wilson disease patients. The study drug I was on for those 5 years truly gave me my life back. It reversed my neurological symptoms, and it allowed me to live a life without constant nausea or side effects. Going through that experience showed me just how powerful the right treatment for a patient can be. It changed my life, and I believe it has the potential to change the lives of others living with Wilson disease. That's why I'm here today sharing my story.